including thorax, xiphoid pain is there. So what to do? Xyloid, sternum, cervical pain, differential diagnosis. Internal and mediastinal affections, respiratory disorders, local anesthesia 2.5 ml, needle 0.6 into 30 ml.
सर
Instead of that, हाँ
रिपीट कर देना 1-2 मिनट क्यों यार मैंने अभी रिकॉर्डिंग चालू किया
go back.
जी अच्छा भाई
I will go with the Facebook today. I like to teach something from my mind. It is difficult for me to read. We'll go with the second video.
तो भाई ये श्वेता आई थी ना बोला क्या कराएंगे
So he is a childhood paralytic patient. Today you will see how by non-invasive brain stimulation he revive his hands. He had brain acupuncture technique. Now you can see I am inserting a needle which is deep inside. You can see the scalp. Now I stimulate it.
This is an autistic child and ADHD child. Now you can see within few days how he came to control and how well he is cooperating.
आपसे पुश करने बोलो
तेजराज जी नीचे की तरफ पुश करिए एल्बो को नीचे
उधर मत उधर उधर
यस
बाहर की ओर हाँ
वेरी गुड अगेन
और दबो
यस
करो हाँ
यस
करो बेटा करो करते
यस
फिर करो
यस सर एक्टिंग ग्रेड 4
हाँ
ग्रेड 4 एक्टिंग
माँ को दिखाओ
क्या दिखाएं क्या
आप यहाँ से होल्ड करिए एल्बो और इसको यहाँ से ग्रिप करिए और बच्चे को बोलना है कि बाहर की तरफ पुश करना है
तुम लेटर बेटा
आप लेट रहिए तेजराज जी
तुरंत जाना है पेशेंट क्यों रहा जाना ही है
नीचे की तरफ पुश करो
मेरे तरफ खोल बाहर
या
करो
यस
जोर से पकड़े धीरे से पकड़े मतलब
अब
धीरे से
इसको स्टेबलाइज करना है ओनली यस यस
करो बाहर बेटा
फोर्स आ रहा है ताकत आ रहा है
हाँ आ रहा है
और आ जाएगा
So you can see from grade 2 to grade 4 in one simulation you can see this is what we are doing.
अब देखिए
यस यस यस
फिर क्यों ऐसे ही करो ऐसे ही करो
वेरी गुड अगेन यस यस कम 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 अब पहले से ज्यादा आ रहा है यस 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 कम 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 कम
करो बाहर
आ गया
यस सर
बचपन में कोई स्ट्रोक आया था क्या इसको स्ट्रोक आया था ना कैसे हुआ
नहीं जैसे जन्म लिया ना उसके बाद रोया नहीं है थोड़ी देर
सिर्फ चल रही
हाँ उसके बाद ये सब प्रॉब्लम
अब इसको इस तरफ लो
अभी आपको एल्बो करना है ठीक है अभी नहीं
आइए हिला पाता था हाथ
This is my very new technique. Blessing scalp has become all technique.
भारी जी नहीं होता हल्का पेन वगैरह पकड़ता है भारी जी
I have completed the book of blessing scalp
ऊपर ही मार देता
and I'm going to give it for binding. Those who have purchased the pen, they may buy and they need not to buy. They'll get At the pressing cost, they can buy it.
अभी आपको ऐसे करना है, ठीक है? अभी तक फिर पकड़ते थे ना?
मतलब पढ़ता भी है तो उसी हाथ से, इससे कुछ भी नहीं करता है।
अभी देखिए आपका हाथ नॉर्मल हो जाता है,
Yes.
नहीं गिरेगा।
ये उंगली भी है दोनों ऐसे।
अरे आप रुकिए ना 2 मिनट।
कंफर्टेबल?
वापस वैसे
चलिए लाओ। यस 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 यस, वेरी गुड। उसको इस वाले हाथ से ही करना, आपको नीचे की तरफ लाना है। नीचे लाइए। यस, कम कम। यस, करिए आप, कंटिन्यू। ये देखिए, पहले पिन पकड़ते थे मोबाइल, 200 ग्राम का है।
Earlier there was no grip in his hand. Now you can grip the mobile.
रेसिस्टेंस से करो।
रिस्टेंस देना है।
रेसिस्टेंस से करो, इतना देना है।
चलो लाओ अंदर की तरफ एल्बो। या गुड, अगेन। यस यस यस,
आगे अच्छा।
या सर, यस यस, वेरी गुड।
फैन ऑफ करना है बेटा।
यस यस, गुड। वेट,
अब ये हाथ ऐसे ऐसे करेंगे।
इसको बाबू इसको ऐसे करो, तेज देखो मम्मी कैसे करे, ऐसे से करना।
यस, एल्बो फ्लेक्शन के साथ आ रहा है। चलो रिस्ट एक्सटेंशन।
ऐसे नहीं, फेंको नहीं, वो ऐसे।
तेजराज जी फेंकना नहीं आपको,
ऐसे
ये
करो
मूवमेंट
बेटा,
करना है
ऐसे
आपको, ठीक
ये
है?
सिर्फ मोड़ना, ये नहीं हो रहा है।
या
हाँ मोड़ो मोड़ो, हो जाएगा।
यस, कम।
करो, मोड़ना फेंकना है धीरे धीरे।
यस,
ये किया। नहीं अभी रुक जाओ, ये बोलना है।
आप लोगों को थोड़ा समय देना होगा इसको, अगर आप ठीक करना चाहते हैं तो। हाथ पाँव ये बचपन से है ना।
हाँ बार बार
हाँ, आपको 1-2 महीना देने से
8 years हो गया।
हाथ
But
चलने
until
से
they would
सारा
develop
जीवन ऐसे ही जाएगा।
medicine, and he could not sustain any of the medications.
हाँ,
स्वभाव से बहुत शरारती टाइप का।
वो हाइपर एक्टिव चाइल्ड बोलते हैं इसको, वो भी कम हो जाएगा। देखिए अभी कितना कोऑपरेट कर रहा है।
रिस्ट एक्सटेंशन सर।
हाँ,
यस, करिए। या सर, विद एल्बो फ्लेक्शन। यस यस, कम।
करो
ये जो था का रिस्ट एक्सटेंशन, ये एल्बो फ्लेक्शन यही था सर, बट अब रिस्ट एक्सटेंशन के साथ ये आ रहा है सर।
अब इसको बोला हाथ सीधा उठा के यहाँ लाए।
अभी क्या करना है आपको, शोल्डर पीछे की तरफ ऐसे लेके आना है। या पीछे, डाउन डाउन
सर
डाउन 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 डाउन,
खुद ऊपर आने, आगे लाओ,
आगे ले जाइए स्ट्रेट करके।
इधर लाओ, इधर लाओ। वैसे
सीधा लाओ,
फिर पीछे ले, पीछे ले।
पीछे ले जाओ। अब ये वाला मोमेंट लेंगे।
एब्डक्शन मूवमेंट।
हाँ
बाहर की तरफ हाथ लेके आना तेज राज्य लाइए विद वीडियो लेटर रोटेशन
आ गया
यस
आगे फिंगर का रोटेशन आएगा ये आंगली बंद करके खोल सकता है आप लोगों ने 8 साल से कुछ नहीं हुआ ऐसा ऐसे ही छोड़ दिया 8 साल
ट्रीटमेंट लिए
क्या फायदा होगा
वही चलने लगा बोलने लगा पहले ना बोलता था ना चलता था
क्या ट्रीटमेंट लिया
और ये आपको हम सिर्फ ये क्या पॉइंट वाला क्यों प्रेशर होता है
हाँ
मैग्नेटिक वो किए क्योंकि एलोपैथ इसको सूट नहीं करता है चिल्लाने लगा एलोपैथ दवा लेने के बाद बहुत चिल्लाता है तो सिर्फ वही किए तो उससे इसको फायदा होगा
अब देखिए मेरा आंखें खोलो
कैसे करना है आंखें बंद करो पहले आंखें बंद करो आंखें बंद करिए आप
हाँ
फिंगर मूवमेंट करिए
ऐसे ऐसे करना बेटा आँख बंद कर करो हाँ
यस गुड
अब सारा सारा देख रहा पूरा हाथ आ गया अब सारा मूवमेंट चेक करो हाथ का
चलो नीचे लाओ शोल्डर को नीचे की तरफ सर शोल्डर पे लेफ्ट हैंड पे ग्रेड को
हाँ एकदम बल्ब से समझ नहीं हाँ चलिए देखिए
नीचे की तरफ फोर्स लगाइए यस यस अगेन
तो देखो
यस सर ग्रेड
हाँ आप चेक कीजिए
यस नीचे की तरफ फोर्स लगाइए यस अगेन यस यस सर ग्रेड
वाह, इसको बैठा के चेक कर लो सब आया है क्या
बैठिए आप सिटिंग माइस
You can see an
You can see
hyperactive
a hyperactive child and
child,
the cooperation of a hyperactive child with brain stimulation.
but you cannot move his upper limbs. Now we can see.
ओ बेटा इसका सर MRI रिपोर्ट भी है मेरे पास
He's a hypoxic child, and now you can see. बेटा हाथ ऊपर आप उठाओ. हाँ मेरे हाथ में लाओ.
हाथ मिलाओ
खुदा उंगली. आंगली पकड़ो.
उंगली पकड़ो
ये कर ताली मारो. इधर लाओ. इधर लाओ. ले लो इधर. इधर लाओ. इधर लाओ. इधर लाओ. इधर लाओ. आगे हाथ. अब चेक कर लीजिए खुद चेक कर लीजिए. Let the mother check it.
ऐसे करो बेटा रुको रुको एक मिनट बस पकड़ो मम्मी को पकड़ो इसको
ये उधर अभी कस के नहीं कर पाएगा. किन्नर मदर से हम लोग नहीं हुआ.
ये पकड़ो
सारे मोमेंट्स आगे पहले से क्या ठीक है।
मतलब कि पहले जैसे
अब वैसे करो, बोलो पहले ऐसे
पहले
करो,
तो पकड़
हाथ करो अपने आप को।
एकदम soft
हाँ ऐसे करो,
लूज
ऐसे करो, ले जाओ ऊपर, दोनों हाथ ऊपर,
और
हाँ बहुत हो गया ठीक। तो ये कब से था ऐसा?
जन्म से
So this child was ये जन्म से बच्चा CP child का he could not move his upper limb since child. Now you can see we have done brain acupuncture and then you can see by which he got immediate recovery and immediately his hand started moving. अब आगे से कितना अच्छा लग रहा है आपको? ऐसे नहीं देखा जाता, मूवमेंट देखिए।
मूवमेंट देखिए मैम।
ऐसे करना है ऊपर का ऐसे थोड़ा होते पूरा सीधा होने को पहले
सीधा क्या? अब ऐसे देखिए, मेरा मूवमेंट चलो,
ऐसे करते
नहीं ऐसे नहीं, ऐसे चलो।
देखो हाथ कस्टमर
हाँ अब देखो, अब देखो, अब खुद देखो, देखो
बोलो तो बेटा मारो
अब अंदर ले जाने दो,
अंदर खींचो अपने तरफ खींचो
ऐसे नहीं ऐसे।
मजा आ रहा है
ऐसे नहीं, अब बेटा एक बार में ऐसे खींचो। हाँ नहीं ऐसे नहीं, एक बार में
जैसे बोलो पीछे घुसो
आप पकड़ के देखो,
खींचो अपने तरफ खींचो खींचो
कितना % रिकवर्ड हो गया? 50% कहाँ? चार मोमेंट तो ले रहा है। बस देखो, ये पकड़ो, ये हाथ टच करो, ये टच करो, ये टच करो, ये टच करो, ये टच करो। अभी तो बोले थे आपका बेटा आपका हाथ मूव नहीं कर रहा है,
सही तो बोले झूठ बोले थोड़े
और आप बोल रहे हैं कि
अब पैर में भी सर देखते पूरा मुड़ रहा है सब
पैर में मोच ठीक हो जाएगा और ये भी ठीक हो जाएगा।
बहुत इसको प्रॉब्लम होता है स्कूल वगैरह जाता है ना बैग लेके एक हाथ से बहुत दिक्कत होता है
ये सब ठीक हो जाएगा।
You can stop the video.
50%।
You may ask me questions now.
Hi, sir. How are you?
Oh, I am fine. Don't you see me taking classes again? I've been discharged from the hospital and I immediately joined the clinic and posted the video.
Alhamdulillah, so you are better.
You
So I
can
wanted
see
to ask
the-
about the.
1 minute. You can see the first video also. It's a very difficult video. There was twice brain surgery, voice was closed. There was a tibial fracture. The lady was unable to walk. And today you will see the lady is able to walk. They call it in Telugu Chala Bhavandi.
Okay, so you're saying this new technique is not blessing scalp. What is the name of this new technique you are using?
I called it as brain acupuncture.
Okay.
Maybe future again I'll change its name.
Will you be teaching more about this new technique, sir?
Yeah, I'll work on point basis. Now I can teach you many things about the points.
So this technique uses the
But these
points.
points are not TCM points. These are my own research points.
Okay, sir. Thank you. Looking forward to it. Thank you, sir. Oh, another question, sir. Did you find out about the courier to US for the pens?
Oh, that I'll have to find out from Guwahati. Let me see, my person is there. I'll talk to him because I was too sick. My blood pressure was less than 20.
Yes, yes, I saw messages. It's good to see you back on your feet again, sir. Alhamdulillah. Thank you. Okay, sir, looking forward for your response.
Ask questions, technical questions ask.
नमस्ते सर।
हाँ, कौन बोल रहे हैं?
रविन सर नेपाल से।
हाँ, रविंद्र जी, please.
खुश लग रहे हैं सर आपको देख रहा। सर
हुकुम।
2-3 सीपी चालों ने मुझे यहाँ कांटेक्ट किया है।
हाँ,
तो एक को बोला था कि वो एक तो वहाँ से इंडिया का है, उसका उत्तर प्रदेश से आपसे मिलने के लिए बोला था। नेपाल का 2 केस भी मुझे कांटेक्ट कर रहे हैं, लेकिन वो लोग बोल रहे हैं कि यही कराना है करके। तो मैंने तो बोला आपके पास जाओ करके। उसमें मैं कुछ कर सकता हूँ सर या क्या?
आप कोशिश करो।
हाँ सर।
कोशिश से तो भगवान भी मिलता है, कोशिश करो। बिकॉज चेंजिंग द फर्स्ट ये हाइपोक्सिक चाइल्ड होते हैं। दिस CP child, a hypoxic child, the brain is entirely damaged. To repair each part of the brain is just like a big headache. Is repairing a accidental car totally crushed down.
उसमें तो मेरे जो पास जो भी केस आते हैं आई जस्ट रिफर टू।
Good evening, sir.
Who's speaking?
So this is Alpana from Bangalore, sir.
We'll go with the first video. First, you will see a lady who is walking after 3 years. You will like to see? Wally, can you go to the first video?
From last to 2019, who cannot even speak. You will see her walking on the walker today. For the first time, she will be walking on the walker, and you can see the movements of the leg.
Her weight is more than 108 kgs. She came with 153 or 140 kgs. We have reduced her weight to 100, less than 100 kgs. Her face swelling and everything has been reduced. This was brain mapping. How to reach the target? By stimulating which area? The old technique NIBS had a lot of problems. So we had to modify it. I found it much easier. I tell you why I found it much easier.
Now we'll see. पहले ये लो, मी वाला.
लक्षण वाला.
Action. इसको
కిందికి తన్నండి, చెప్పినప్పుడు తన్నండి.
She has a tibial fracture. Now you see, we have recovered our tibial fracture almost by stem cell therapy.
ग्रेड 2 तक ही जा रहा है, अराउंड ग्रेड 2.
अब देखो.
बोलो आप तेलुगु में बोलो. చేయండి మళ్ళీ మళ్ళీ. यस, थोड़ा सा इंक्रीज हुआ. यस, ग्रेड 3 तक, अराउंड ग्रेड 3 तक पूरा
Grade 3 आ गया?
यस सर.
Now you can see I'm stimulating two of the needles.
మళ్ళీ వెనక కనుకోండి, వెనక తీసుకోండి. వెరీ గుడ్. ఎస్, గ్రేడ్ 3 అవి సార్.
अभी ग्रेड 4 आने वाला है।
या
1 मिनट दो दो।
ग्रेड 3 तक ही है। ग्रेड 4 कर दीजिए आप। रेडी कर दीजिए। चलिए माता जी, सारा पीछे। वेरी गुड। अगेन। यस सर, दिस इज ग्रेड 4।
ग्रेड
4।
आ गया।
यस सर।
एडक्टर एडक्टर
Abductor sir. Now outside. Yes. Abductor muscle sir, grade 2.
अब देखो।
No. बाहर की तरफ आउटसाइड फोर्स लगाइए। अगेन। पहले से सर इंक्रीज हुआ ग्रेड 3 तक।
ग्रेड 3 आ गया।
यस सर।
Now you see, I'll improve more.
Now, माता जी। यस यस यस। ग्रेड 4 तक सर आ गया। एबडक्शन मूवमेंट विद रेजिस्टेंस।
आ गया।
यस सर।
अब इधर आओ।
आपको एयर साइड लगाना है, ठीक है। नाउ साइड। या यस। नो अगेन सर दिस एडक्टर मशीन से ग्रेड 1।
but never for blood leaks. New always discreet boutique plug. You're protected all day. And if it's discreet, you can get another. Always discreet boutique.
No.
So for a piece.
This is a twice post-operative tumor case. तो अब post-operative tumor हो गया 2020 से totally bedridden है. Now you can see how we are making our work today.
And to keep your computer. Now, this is an important part of it.
ये बोला था ये जीरो था, एड्रेस कोड में आ गया कुछ।
Yes.
ఇంతకుముందు అసలు రాకపోయేది అది అట్లా దగ్గరికి ఇప్పుడు దగ్గరకు వస్తుంది అంటున్నా.
Yeah. Yes.
ఇంతకుముందు వచ్చేది అట్లా మీరు చూడండి పట్టుకొని వస్తుందా లేదా
रिफ्लेक्शन दिखाओ।
आप 1 मिनट, आप यहाँ से होल्ड करना है, माता जी को बोलना है कि अंदर की तरफ आपको
मैं पहले नी फ्लेक्शन नी से बेटा पहले फर्स्ट मूवमेंट
అది చేశారు కదా అది చేయండి.
now that hand is fine now. नहीं फ्लेक्शन करिए आप.
అవునవును
Yes.
ఇది పెడతాయి అనుకోండి.
The deal worth over $5,000. It's not just you can walk away with $500 guaranteed.
Meaningful beauty is more than $139.
చాలా బాగుంది
చాలా బాగుంది
పోస్టర్ కి ఓకే
चलो आप पीछे से पूछते हैं. Yes.
So here you can see a lady who was not walking from last 3 years. You can see after the brain stimulation she has started walking.
आगे क्लिक करिए. Yeah. Yes. Yes.
See the movements you can see.
100 kg.
See
Yes.
movement, Amma. Movement.
Yes.
Plus is a malunion fracture.
With the fractures still moving now. Malunion fracture, which we revived with stem cell therapy.
Yes.
तो मुझे पहली बार चल रहा है
ఇంతకుముందు నడిచారా ఇట్లా
इस तरह से इस तरह से इस तरह से
ఇలా స్టెప్స్ వేసారా
फ्री है ये तो देखो आराम से चल रहा है देखो इसमें इसका फ्रैक्चर हुआ है
Yes sir. And TKR knee replacement sir.
टिकिया नहीं है ये फिबिया
हाँ.
टिबिया फ्रैक्चर है मेल यूनियन ऑफ टिबिया
You could see now, switch off the mic video.
देखो इंजेक्शन काम आया ना इंजेक्शन काम आया ना कैंसर में इंजेक्शन
ఇంజెక్షన్ ఇచ్చిన
Guruji, no more video, please. Guruji, no video. No video. Close the video, please. Walid, close the video. You may ask question, please.
Sastri ji. Sastri ji.
Yes, I'm hearing, Babu.
Yes. How did you get her to lose weight when she was stationary?
It
You said
was
you dropped
a
her weight.
difficult issue for us. We restricted her diet, and also we started a typical therapy of brain stimulation in which her craving of eating food was less. And then gradually She lost around 30 kgs of weight. Otherwise, she has broken my one of the knee holder. More questions? This is what I say. This is the power of the brain stimulation. Our elders were not fool that 5,000 years back, 10,000 years back, they wrote something. This is wrong. Because we are not able to understand that. So we are trying to understand it in our own way. And we are finding results. We wanted stimulation because it's electrical connection inside the brain. One command recovers the muscles. It takes time because the nerve, see, whenever there is a paralysis, the nerve becomes neuropathic. Neuropathic means there is no conduction in the nerve. So when there is no conduction in the nerve, first is to bring the conduction in the nerve. So you have to bring the conduction in the nerve. Once the nerve conduction comes, then use brain stimulation and revive the patient. And for that, we check with NCB test how much it was yesterday and how much is today.
So may I ask?
Please, may I know speaking?
So I'm Lodha here from Pune, sir.
Yes, Mrs. Sardar, tell me.
Okay. So my very small doubt was that when we are doing this stimulation with the electro pen, the laser pen that you suggest, there's
See,
must
this
be
electro pain is not the massager pain what you see in the market, right?
no, sir. What you've been using or you've been showing us, no? So
It's
is it a
a
similar
different way
thing?
which we have. See, generally in our clinic, almost you refer us most difficult cases, right?
Yes, sir.
Including these lady cases. So we
Yes, sir.
keep modified things to upgrade ourselves to revive these patients.
Right, sir.
When we see revival of these patients, we see that we should share this knowledge instead of keeping with us.
Right, sir. So my question is that when we are stimulating, so is it the similar current kind of sensation that passes through us also?
Yeah, you will also have a similar type of current sensation.
And sir, does that affect us in any ways?
I have done more than 20,000, how many lakhs of times. What did happen to me? After coming to blood pressure 20, did I die?
So you are a miracle baby.
So this time I'll show you what are the topics of this one, what you call. You will have a discussion on these topics regularly. So
Yes.
please
So
go to my Facebook. Go to my
how do
Facebook, and you can
how
also
do we,
join.
how do we reduce the hunger, sir, of the patient?
See, all it is not easy. You must understand from basics. See, you are asking class 12 question. How many years did we study acupuncture? Did we study 5 years like Chinese?
No, sir, 3.5 years.
So 3.5 years is just nothing. In India, the way we are teaching, they themselves don't know how to do it.
Agreed, sir. Long way to go.
So go from what? Line by line. And you will see the road is very beautiful. Your clinic will be always full. You see, my clinic is always full.
Yes.
Yeah, you see, I have posted first video, third you go third, third.
Headache. Madam, where is the headache?
Now you can see how I integrated this prolotherapy
You're having a headache
with
from
dry
here
needles.
to
See that
here.
you see the headache over here.
Now we can reduce it by 2-3 points. Go needle now. This is one. This is second.
I told you yesterday, their headache can be reduced in 1 minute. She was having acute migraine. She have taken medicine. She did not get relief. This brain and muscle pain. She was having acute stress attack.
Headache? కొంచెం nahi. Pain how much? Taking means now how much pain she is having? So you can see I have placed 3 needles over here and our almost headache has gone in just 1 minute. She was having this headache from how many days?
Sir, from yesterday.
From yesterday. It was very severe.
Very serious.
And now how much headache she is having?
Now she's feeling good. నిన్న టెన్షన్ వచ్చింది సార్ అదే
Now how much headache?
ఇప్పుడు ఎంత ఉంటుంది అంటే అదే ఎంత
Little bit over here.
Yes, sir.
So we'll reduce it by this video. Check.
తలనొప్పి చూడు
Yeah, check. Again? Our pain has been totally reduced in 1 minute. You can see this is the power of integration of advanced acupuncture in prolotherapy. You don't need to
Because lidocaine has a side effect. It may do lot of side effects. But this will not do any side effect. It won't hurt the artery manage. It may not create any side effect. This is the best way to revive a patient. So go to my Facebook. Go down. Up. Where did I post about the seminar? Can you see? These are all the cases I did. Up. I posted. Wait a minute. Walid, I'm giving you.
Yes, sastri.
What did I give you? Wrong thing I gave you. Wait a minute. Wait a minute. Yeah. You can go with the topics. I've given you now. Check it.
Sastriji, what you gave me is training certification with the recovery pain at Elias with workshop.
Yeah, I've given you
24th
from
June.
MK Sastri 2,50,000 videos. advanced
No
reading and
link on the,
certification
no
course.
link to the videos, sir.
Huh?
No link to videos, sir, on the post you gave me.
It is the third link.
Should I?
You can post it, na?
Yes, sir. It's all.
Yeah,
Let me show you what.
And third. After the headache, see, after the headache one.
Hold on, sir. Let me show you what you gave me. This is what you gave, sir.
Let me check.
It does have the.
No.
The
Yeah,
link.
this one. This one.
This it does not have. It only tells what we'll be doing, but it didn't give a link to videos.
No. I have not given the link. I made it today only. So you can see how to. What are topics we will touch this time? What are they?
No topics here, sir. Seminar workshop, brain acupuncture and spine. Continue. Prolotherapy and advanced prolotherapy integrated with acupuncture and preneural injection therapy. Advanced non-invasive brain stimulation and mapping. Hypnotherapy and past life regression. Intraocular stem cell therapy.
Intraarticular stem cell therapy.
Yes. And this is helpful in sports injuries and pain management, many types of paralysis, epilepsy, depression and anxiety, past life regression, glaucoma blindness, retinitis pigmentation, yes, peripheral neuropathy and neuropathic conditions, autoimmune disease, spinal cord injury, etc. Evidence-based with EMG and NCV-based.
So you may ask me a questions. Ask questions. Ask questions.
Good evening, Sarji.
Yes, madam, tell me.
So previous patient you treated, that was through cortical and then bulbar pathway, no, sir?
No, madam, it was not a cortical pathway, no bulbar pathway. Both pathways are simultaneously used. See, when you go from the leg to hand, it is bulbar pathway. From brain to hand, when you go, it is corticospinal pathway. What I did is that I played a special trick, and I want quick recovery because they are from very rural area, and they think that their child will not recover. So to instantly recover the child, I did immediate brain mapping, although I arrived from the hospital. And I did it in the hospital itself. And you could see all the patients who are requiring lidocaine can also be recovered by what? Dry needle brain stimulation.
Yes, sir.
It takes seconds actually. Only the problem is pain will trigger again. Yes, because the reason of the pain is not gone. You cannot say in one day you can change yourself. Can you change yourself in one day? No. So it takes times to change. But yes, you can see the results are very good. Patients have recovered. Everything has been live. Nothing was edited. And results are there. And this is what I did after just discharge of the hospital. I came and I started my work.
Instead of lidocaine, that is giving anesthetic effect. That's why you've used that, sir.
No, I don't give anesthetic effect. Madam, it is not required. Endorphin corticosteroids are already there. So why should I give anesthetic effect? Rather, why don't we try to recover that area? Brain knows how to recover. If I give lidocaine, it's anesthetic effect, but I don't give lidocaine. I'm not using pain gate theory. Otherwise, how the patient of paralysis will recover with this area? My question is, if you are using the same theory, how does the patient recover with the paralysis? And there are 250,000 videos. How much?
Yes, 250,000.
So I think it is evidence. This evidence is good enough. You can see me in the OT room also. You can see me with Siam also. You can see me with this also.
Yes, sir, I've seen.
No speaking.
I'm Alpana from Bangalore, sir.
Okay.
India.
More questions?
Sir, can we have a discussion on chronic liver disease?
Chronic?
Liver disease.
What kind of disease you want to select?
So there is one case has come where there is a portal hypertension, and so his this one LFT function is totally dearranged, and so by our like this using the Trunks acupuncture and dietary modifications, I could bring some just biochemical changes in this one, yes, LFT parameters, SGOT and SCPT, but still it is in higher range. Generally, so ultrasound is yet to be done for the second time. So the patient has come to me with the semi-conscious, semi-unconscious patient. So
First of all, I advise you never touch this type of patients. They may die on the table also.
he was my own
I
relative.
always say, don't take risk. I have taken enough risk. I have suffered enough. My first question is, please don't, even the higher hospital, even the hospital where I went today, of Avinash, he referred me to, he himself went with me to the other hospital to get admitted.
Okay.
You understood? Because the infrastructure of that place and the infrastructure of a clinic is not competent to manage these children. If by chance something goes wrong, who will be blamed?
I will be blamed.
Then don't do this.
By the God grace, in this case, the patient is totally conscious now. He is.
Babu, first of all, get the CT scan, MRI of the brain. What is wrong with the brain? First you see.
Yes.
Don't see with the symptoms, but see with the disease. You see the symptom, nothing will come out. See the disease. Right, I went to angiography. I saw that my angiography was okay. With a very small hole. I had a hole in my heart because for which I had 4 heart attacks. So they were telling me to do open heart surgery. Rather, we went with stem cell therapy. Today I saw the hole was very, very small.
Okay.
And you will be happy to know we have formed the cheapest stem cell therapy in India. Now we are doing intra-articular. Orthopedic surgeon is coming. Now we are doing intra-surgical, intra-articular surgery.
That's great. That's great. You are our inspiration.
No one is inspiration. You all are your own inspiration. My only request to you is that after I put everything, please share this so that people get aware, more people
Yes, sir.
join, let the group continue, knowledge continue. Who knows when I when I go back from this world.
We'll do it, sir.
More questions?
Sir, how are you feeling now, sir?
Drowsy and all will be there. Witness will be there for another 10 days because they have given heavy doses of medicines. But then I have a strong willpower. I use my willpower and I continue my job. So I have taken one canal. After I go, I'll take saline and then I'll sleep.
Yes, sir, we have seen it, sir.
More questions?
Why you've been given central line, sir?
Because they did not find artery in my both the hands. Both they were thrombosis. They pit, then boy, you can see my hands. Thrombosis. Are these nurse trained or?
Hello, sir.
Yes.
Please, can you take this week to take time to rest, please? Because I can see that you need it, so that we resume class next week.
See,
Please,
talking to you itself is a rest.
Sir?
Talking to you all itself is a rest. You relax your mind. You go out from all patients, things, and you are relaxed here. No one is there to disturb you. No one is there to hamper you. No one is there to torture you.
Well, can you take 1 or 2 days out to take your time to rest? I know you love to meet people, but for your own good, sir. Maybe tomorrow and next to just be on your own
Let us
and
be
take
there
time.
up to 10 more minutes. Let us there be for 10 more minutes. Why should we stop our time? Let us go by time.
Okay. It is well with you, sir.
Ask questions.
Dr. Sastri, I'd like to ask my question.
Oh, yes. Yeah.
Yes.
Tell me.
2 questions.
Oh.
How does Kennedy disease affect one's mobility and the interrelation to sleep disc? How can NIBS help? That's
No, I
my
did
first
not
question.
understand your question. I did not understand your question.
How does Kennedy disease affect one's mobility? There's one part of the question.
See, different type of disease affect different types of mobility. It depends on the type of disease which you are suffering from, to which grade, to which level, to which understanding. And then these people, they hardly they live and hardly they survive.
So
Most
Kennedy
of the
disease.
patients you see here are very difficult cases. Today I show you some easy cases. From tomorrow I'll show you some practical cases. You will see how frozen shoulder and all can be recovered just by 3 needle, 2 needle. And you all can practice.
Okay, so my second question is, how does a clot in the heart being in a AFib rhythm for too long result in a stroke?
See, whenever there is a clot, the blood repasses again. The question is the blood has to flow in its own direction. If there is a clot, blood will go, it will return back.
Okay.
And then it's a stroke.
But that can be recovered very quickly, right? Without major damage. Is that right?
Yeah, you can recover it by giving ecosprin and other medicines are there. And even surgeries are there. So heart is not a bigger problem to recover. The biggest problem we are facing today is the recovery of the eye in the brain. Eye has no recovery, brain has zero recovery.
Okay, thank you.
No questions? More questions?
Another question is, how can Parkinson disease affect prostate issues? And how can NIBS help with this?
Prostate. We're asking about prostate, right?
Yeah. How can Parkinson's actually
No,
affect that?
Parkinson has nothing to do with the prostate disease. Parkinson is relevant to dopamine. So dopamine, if it's reduced or depleted, the tremors will start. And if you go with what you call prostate, it's a gland. It will enlarge with age and will block the way of urinary pass. So one is a surgical case, one is also a surgical case called deep brain stimulation, but DBS is a risky case. It may destroy the life of the patient.
So supposing if certain drugs, Western drugs are taken and affect the prostate issues, is that a correlation?
It is very difficult to say because all this depends on case to case how it affects. Certain cases these drugs affects and certain cases it does not affect. So we advise surgery.
Okay, understand. Thank you.
Any more questions? More questions?
Oh, pertaining to the recent outbreak of monkeypox, do you have any opinion or
No,
explanation
I have
there?
no opinion, no experience.
Oh, okay, sure. Okay, thank you.
More questions, please. So we will switch off the class now. Thank you so much.
Everybody, sastri is left class. So good night, everybody.
Good night,
Oh,
Shirley. Thank you, everyone.
Good night, everyone. Have good rest.
Good night, everyone.